Thank you to the ITTF Foundation for inviting me to participate in this conference. My name's Trevor and I represented Australian table tennis for 10 years and have a PhD in cognitive neuroscience. I now manage the training academy for a global mental health company called Neurocare, which focuses on adding brain training and brain stimulation to mental health care and performance. I'm going to speak about how amazing table tennis is for healthcare in so many ways, by using my health story to illustrate a few of these ways. I'd played table tennis since I was 4 years old at home and was state under-13 champion when, at the age of 12, in 1991, I was diagnosed with a tumour deep in the brain and given 3 months to live. Fortunately, the doctors found a way to attempt an operation and I came out alive, but with my right eye closed. Thanking the surgeon, it was completely unknown how my eye recovery would go. Fortunately, table tennis is a sport requiring visual processing. I found out that during the operation, parts of the brain associated with my right eye had been damaged, causing it to close and lose control of movement. Fortunately for me, table tennis works the visual system very hard, changing the brain along the way, and getting back to training only a week after surgery helped my eye to open and then recover control of eye movement. In fact, visual processing works in a very complicated way and involves so many different areas of the brain. A few years later, after a lot of hard work of course, I was Australian junior champion. Then I qualified for the Olympic Games in Athens 2004, a culmination of 13 years hard work. My table tennis and health journey continued. My career ended in 2010 when I was diagnosed with an autoimmune condition called ankylosing spondylitis, a condition typified by inflammation in the sacroiliac joint in the lower back, and inflammation and fusion of vertebrae through the spine. But over a 10-year period, through lots of table tennis and other factors, I managed to reduce inflammation to a minimally painful state and maintain full flexibility with no fusion of joints. Table tennis is a great sport for full movement of the body and has definitely helped me maintain and recover physical health over this last decade. Upon coming home to Australia, I completed my PhD in cognitive neuroscience, showing how the brain of elite table tennis players differs to amateur players in their visual spatial attention. I did this firstly by recording brain activity during a simulation match. This showed me different brain activity for players of different abilities, during different brain states. Secondly, I developed a visual task, showing differences in accuracy and reaction time between groups. What it also showed was where in the brain the largest differences were between the groups and what target to use for subsequent brain training. Finishing my PhD led to my current role as Global Manager of Neurocare Academy. I'm fortunate to be able to read new research, synthesize it, build and update our training courses, and teach our psychiatrists and psychologists to apply brain training and brain stimulation techniques, including neurofeedback and TMS, which stimulates the brain using a magnetic field and is used throughout the world in depression treatment, for which it's received Medicare rebates in many countries now, and is also being used and researched in many fields, including OCD, Parkinson's, and Alzheimer's disease. One further thing working with a mental health company has taught me is how important it is to combine psychology with these neuromodulation techniques. It's imperative to continue the total patient care, working on life factors such as sleep, exercise, and social aspects such as belonging. Table tennis is a prime candidate for assisting in many mental health patients' lives. Just to illustrate this point further, last year I was diagnosed with stage 4 melanoma and I'm currently fighting that battle. But my good physical condition after years of table tennis exercise has prepared me well. And my sleep is so much better when I've done some physical exercise. And guess when the body repairs and fights disease the most? It's during sleep. But most of all, All the close friends I've made through table tennis throughout the years are there for me, supporting me, encouraging me, helping me to stay positive and fight. Teammates like Meow Meow, Russell Laval and Brett Clark, and coaches like Alois Rosario. Belonging to a table tennis community is so important for mental and physical well-being. So, in conclusion, wouldn't it be fantastic to investigate and elucidate the benefits of table tennis further? How and where in the brain does it create most brain change? Where and how much do the lifelong physical benefits assist in, for example, inflammatory disorders, pain, and other physical conditions? And how much does table tennis assist in maintaining a mental well-being, decreasing or preventing disorders like depression via factors such as belonging and the real tangible value of the social interaction and friendships developed? Can we create a Table Tennis for Health program that understands these factors more precisely and guides table tennis into areas of best utilization? There is such potential to use table tennis in healthcare prevention, health maintenance, and treatment or recovery from disease. Thank you for listening. Hope this has given you a small taste of just a few of the potential ways for table tennis to benefit health. If you'd like to contact me for anything related to Neurocare, my email address is there, and also my private email for table tennis related contact. Thanks, and please enjoy the rest of the conference.